All right, let's go ahead and get started.
Okay.
It's 5:45. When you signed in, did you have a little note that this was recording?
Yeah.
Okay. Because I don't see the wording that it's recording, so I want to make sure. All right, so we're covering page, in your book, it's probably 307, hypertension. Is that correct?
306.
306. So hypertension. And page 20 in your ICD-9 guidelines. If you look under the heading myocardial infarction, an MI or myocardial infarction falls under the category code 410. Your myocardial infarctions are going to require a 5th digit. So you will have to indicate, is it a 1 or a 2? When you use the 1, it means that you are reporting the initial episode of care for that myocardial infarction. When you code it with a 2, you're indicating it was subsequent care. So the patient is readmitted for testing and treatment within the first 8 weeks of the initial episode. And you should see that in your guidelines over on one moment. It's actually on page 21 in your guidelines, letter E, acute myocardial infarction. If we use the 412 code, we are actually reporting that it is an old or healed myocardial infarction and that there are no symptoms. So 410 is for acute and 412 is an old or healed. Then we move on to the diseases of the respiratory system, chapter 8. Turn to your textbook, diseases of the respiratory system, and in your ICD-9 guidelines, page 21, chapter 8, diseases of the respiratory system. What you want to watch for in chapter 8 is the use additional code to identify the infectious organism. And I think you saw this last week when we did some of the coding, right? It says use additional code. Some codes will indicate to specify the organism and do not need an additional code. Respiratory failure sequencing, RF sequencing. If an RF is due to an acute condition, such as a myocardial infarction or an acute exacerbation or of chronic condition, such as COPD, there are new guidelines. If there are not chapter-specific guidelines, such as OB or poisoning, regarding that sequencing, you would either use the RF or the acute condition listed first. Okay? Then when we have acute respiratory infection section, over on page 22, acute respiratory failure, letter C, What you will find in this section are the frequently used codes for common cold, sore throat, acute tonsillitis, bronchitis, acute upper respiratory infection, and influenza. And if you haven't already, I suggest that you read those guidelines in Chapter 8 for the specifics on COPD and asthma. And that's it for Chapter 11. Any questions?
No, I don't think so.
Okay. Then let's move on right into our chapter review, theory and practical, Chapter 11. All right, what do you have for number 1, Kelsey?
True.
Yes. 2 is false. What do you have for 3?
False.
Yes. 4 is true. What do you have for 5?
True.
Nope. 5 is false. Hypertension that is caused by another condition is called essential hypertension. That is false. Number 6, false. What do you have for 7?
True.
Actually, 7 is false also. If a patient's diabetes is documented as poorly controlled, a 5th digit for out of control should be assigned. We shouldn't document it as poorly controlled. The documentation has to be specific to the diagnosis code.
Okay.
Number 8 is false. What do you have for 9?
A.
Yes. And 10 is B. All right, let's move on to the practical. What do you have for 11? What diagnosis codes do you have for 11?
281.0 and 336.2.
Good job. Yes, excellent. All right. Carcinoma in situ of skin of lip, vermilion border. You should have looked up neoplasm on the lip, carcinoma in situ, and it is 230.0. What do you have for 13, Kelsey?
421.0.
Yes. 14 is 491.22. 15, 482.32. What do you have for 16?
331.0.
Yes. And 17. 17 is 403.91 with 585.6. What do you have for 18, Kelsey?
008.63.
Yes. Hello, you've joined the coding class. Can you identify who's attending?
I'm trying to communicate on my job. This is a number I usually communicate to.
Nope, you've logged into the coding class.
Okay.
All right, number 19 is 042 and 136.3. Number 20, Kelsey.
250.83, 707.14.
Actually, one off, 707.15.
Yeah.
21 is 263.9. What do you have for 22?
288.00,
Yes. 23, 285.22, 151.9. What do you have for 24?
292.0.
And?
That's really what I have.
Okay. There's two here. The second one is going to be 304.01, and that would be for the dependence of heroin. So the patient has withdrawal from heroin daily use. The key that would tell you there's dependence on it is the daily use. So you would look up dependence, heroin, continuous use. All right, number 25, 3.90, and 26 is 584.9 with 401.9. 27.
492.8.
Yes. 28, what do you have for that?
507.0.
Good job. 29 is V, 51.88 and 153.3. 30, 482.42, 518.82, 319, 599.0, 041.85, and 345.90. Did you get all of those?
I did, but I didn't do
Excellent.
the second one.
That's okay. As long as you attempted it, that's what counts.
Yeah.
And then if you don't get the correct codes, looking them up afterwards to understand why you got the ones you got versus the correct answer. Does that make sense?
Yeah.
All right, number 31, what do you have for that one?
No, I didn't do this one.
Okay, so let's take a look at it. 31. All right, so the patient is an 80-year-old female with a known history of advanced metastatic carcinoma of the breast, which was the primary site. The breast cancer is no longer present but has metastasized to other unspecified areas, which represents a secondary generalized neoplasm. The patient has been admitted because of increased shortness of breath and severe pain. The pain is worse in her left chest, and this is associated with increased shortness of breath. At the time of admission, the patient is in so much pain that she is unable to remember her history. The patient initially presented for congestive heart failure more than a year earlier. This was subsequently found to be secondary to metastatic breast cancer. After left mastectomy 3 years ago, the patient had previously been on chemotherapy. The patient is treated initially with intravenous pain medication to control her pain, and subsequently her condition becomes stable on oral medication. By the time of discharge, the patient is stable on oral Vicodin. She is able to eat. Admission blood urea nitrogen was 38 milligrams with creatinine of 1.3, secondary to dehydration. By the time of discharge, these levels have improved. Admission glucose of 225 milligrams is down to 110 milligrams at discharge. So what they want you to do is the discharge diagnoses: uncontrolled pain secondary to widely metastatic breast carcinoma, dehydration, and type 2 diabetes mellitus uncontrolled. So 31. What is the first listed diagnosis and the code for the first listed diagnosis for this patient? Well, it's right there.
Is that talking about the history or what she came in for?
It's in the first paragraph, it's the second sentence.
So increased shortness of breath and severe pain.
Right. And which one is more acute?
The pain.
Pain. So she's being admitted for pain control. Pain control due to what? What
Due
does she have?
to the metastatic carcinoma.
Breast cancer, yes. So look up admission for pain control due to neoplasm and tell me what you get.
So 338.3.
Say that again.
338.3.
Yes, that is correct. Okay. And then number 32, what are the other diagnoses for this patient and what are the codes? So, all right, we've determined that the first one is the admission. What is the second one? What can you pull out for me? That first paragraph, the last sentence.
The chemotherapy.
Actually, I'm sorry, next to the last sentence. It is the neoplasm, the secondary neoplasm. So that would be the next code. Then the depletion volume, and then the history of the personal breast cancer, and then the diabetes. So your first code, did you get these codes?
No.
Okay, so write them on paper and I'll give them to you. The first one, the neoplasm generalized secondary, would be 199.0. The depletion volume would be 276.51. And then the third one, personal history of the neoplasm of the breast, V10.3. And then the last one, diabetes type 2 uncontrolled, 250.02. So how'd you do with those?
Other than that other than 31 and 32, I did pretty good.
Excellent. All right, so as we get to do more in the workbook, you'll find that I will only assign the even numbers because the odd numbers are in the back of the book.
Oh.
So let's go to the workbook, chapter 11. All right. So, number 1.
$110.4.
Yes, good. And 2, 070.54. What do you have for 3?
031.0.
Yes. Number 4, 601.0 and 041.00. What do you have for 5?
276.8.
Yes. 6, 157.2. 7,
041.02.
yes. 8, 272.2. 9,
279.03.
yes. 10 is 238.8. What do you have for 11?
250.00. 362.01.
Okay. This is actually 250.50, not 250.00. And then 362.01. Sorry. 12 is 211.5. 13, 266.2. 14, what do you have for 14?
I don't have 14.
Okay. 14, let's take a look at 14. Gangrene left great toe due to diabetes mellitus. All right. What is, because they said due to, what are we going to code first?
Gangrene.
Nope. The gangrene is due to the diabetes mellitus. So you would code the diabetes type 1 first. So why don't you go ahead and look that up?
All right. Thank you. Children 25 to walk. So we take less than 10 class. What do we do? We do it or not?
You know, the issue is some people sign up and they get
So I was looking at a website a few minutes ago, and she had, oh, that's a good one. Yeah. It said Kelly is one of Maine's finest artists, loves to inspire others. Probably also an artist. But, yeah.
unless you have some options. Art. Oh, yes, right. Tomorrow.
Right.
Yeah.
We could always do the, well, I don't know, let's wait till Marie says what color painting she does.
250.01.
Close. 250.71. Look at the difference.
Oh, I didn't put the gangrene in there.
Right.
That's why.
Excellent. Okay, so then the second code would be 795.4 for the gangrene. So the patient presented with gangrene, but it was due to the diabetes. So we want to code the diabetes first. 15, 275.3, 16, 287.5, 17, 258.01, 18, 299.00. What do you have for 19?
296.7.
Yes. 20, 289.1. 21, what do you have for 21?
038.0.
Yes. 22, 040.82. What do you have for 23?
295.32.
Yes. 24, 354.0. 25, 305.1. 26, 320.1. 27, 300.01. 28, 332.0. 29, 362.83. 30, 386.04. 31, 366.22. 32, 372.12. 33, 389.15. 34, 402.01 and 428.9. 35, 410.70. 36, 429.2 and 440.9. Do I need to repeat any?
No.
37, what do you have for 37?
416.0.
Yes. 38, 423.1. What do you have for 39?
427.0.
Yes. 40, 428.32. What do you have for 41?
440.1.
Yes. 42, 444.01. 43 is 457.2. What do you have for 44?
461.1.
Yes. 45, 478.5. What do you have for 46?
474.02.
Yes. 47, 491.21. 48, what do you have for that?
513.0.
Yes. 49, 414.01 and 496. Did you have any questions on that one?
No.
Okay. 50, 112.81. What do you have for 51?
482.41.
Yes. 52 is 790.7 and 041.7.
I thought those
53,
had to be the other way around.
let me take a look. Bacterium due to Pseudomonas. Let me take a look. No, because if you look at code 790.7, it says use additional code to identify the organism, and that's where your 041 comes in.
Oh, okay.
53045.02 and 784.42. 54, 199.1 and 789.51. 55, 281.0. What do you have for 56?
I don't have that one.
All right, let's take a look at it. Alcoholic delirium tremens due to dependence on alcohol. So remember, we have due to. And so we would start with alcohol. What kind of issue is going on? He has delirium.
So you go to dependence or alcohol?
Go to alcohol. We're going to do alcohol first because he's presenting with tremors, delirious tremors. Okay, so then what he's presenting with the alcohol, what's going on with the alcohol? It's the delirium tremens. So look that up.
Sorry, I'm late.
Hi, Anita.
I so much traffic and
We're on page 59 in the workbook.
So 291.0.
That would be the first one, yes. And then why is it? Because it's due to the dependence on alcohol. So now we would look up dependence alcohol. So 59 in your workbook, number 56. Do you need a pen or pencil, Anita?
I have this. Can I get this? Sorry.
Yeah, it's not
Is
mine.
that yours?
So
Okay, so page 59,
303.90.
number 56. So you came up with 291.0 for the first one, and what did you say for the second one, Kelsey?
303.90.
Yes. So number 56, 291.0 and 303.90. All right. Anita, how did you do with this homework?
I could not do this.
Okay. So 57, 310.1. 58, 368.12. What do you have for 59, Kelsey?
382.9.
Yes. 59 is 382.9. 60, 60 is 346.40. 61, 360.63 with V 90.89.
That's the last one I did in here.
Okay. So number 62, let's take a look at 62. It is type 2 diabetic mononeuropathy of the legs. So what does the patient have?
Type 2 diabetes.
Right, so diabetes. And what type of diabetes is affecting the legs? Mononeuropathy. So let's look up diabetes, mononeuropathy, and tell me what you get.
it work for you? Same time? Okay. You're welcome. Okay, bye. Marie Jakes is coming tomorrow night.
So 250.60. And
Okay? And then because we know it's of the legs, can you just show Anissa how you got that one?
Yeah, mononeuropathy, 355.9.
Yep, 250.60. And then the last one, 355.8. So the first code is for the diabetes for the mononeuropathy.
Mm-hmm.
And then the second one is the mononeuropathy of the lower limbs. All right?
Yeah, lower lip, yeah.
Okay, 63. Diarrhea due to paracolon bacillus not elsewhere classified. You can look it up just the way it is. Diarrhea due to paracolon bacillus.
zero zero 008.47.
Yes, 008.47. All right, number 64. Mobitz 2 atrioventricular block. What is going on here?
Block.
What's being done? It's a block. What kind of block? An atrioventricular. Okay, look that up.
Twenty-six. 426.10.
426.12.
Yeah.
Okay.
Who-
All right. 65.
Yeah,
You have to go and look
Oh,
at
yeah,
here,
there, yeah.
and then it tells you the Mobitz.
65. Dissecting abdominal aortic aneurysm. What's going on here?
Aneurysm,
What type
aortic,
of what part of the anatomy?
abdomen.
Yes. So aneurysm, aorta, abdomen.
441.4.
Is dissecting referring to anything?
Yes.
So does that mean ruptured?
Yes.
441.5. No, never mind.
9.
Yeah.
9.
441.02.
Okay.
Do you see the difference?
441.02.
How? Yeah. Four 1.4.
Right, but in here it says dissecting.
Oh, okay.
You go dissecting and then abdominal.
You got it?
Yeah.
All right. So 66, 429.4, 428.0, and V 45.81. 67, 443.0, 785.4, 68, 455.2, 69, 451.11, and 70, 480.9. '71, 381.62, 72, 401.9, 73, 793.11, and 74, 275.01. Did either of you attempt any of the reports?
No.
Okay, so we're going to do 2 in class, and then you'll be able to finish them on your own. Now, from here on out, I will be assigning only the even numbers for class. The odd numbers you can do on your own, and you'll see the answers in the back of the book, but the even numbers will go over in class. So let's go ahead and take a look at number 76, which is report number 9. So what we have to do is go to the back of our book and find report number 9. And that would be on page 214 in the back of your workbook. Did you find it, Kelsey?
Yeah.
All right, so it should be an operative report. Is that what you have, Anitha? Page 214, yes. Operative report?
Yeah.
Number 9? Okay. Mass right breast. So pre and post is mass right breast. Operative procedure, right breast mass excision. And then down below, it says pathology report later indicated primary malignant neoplasm. Remember, when we are coding the diagnosis here, we are coding the post-op diagnosis. In this case, we would be coding for what, Kelsey? What do you think?
The mass right breast.
And what is a mass?
Neoplasm.
Correct, neoplasm. And what anatomical site?
The right breast.
It's okay, breast. And then what portion? If you read the procedure, it's in the third line down, it says in the central portion of the breast. And then we see the pathology report indicates primary malignant. So how would we start to look this one up?
Neoplasm.
Yes, neoplasm of the breast, central portion, malignant primary. Go ahead and take a stab at it.
One 174.1.
Say that again.
174.1.
Is that what you have, Anita?
Central, yes, here.
Okay.
174.1.
174.1.
Secondary.
All right, let's look at number 82, report 44, page 239. They're telling us preoperative and postoperative diagnosis is the same with the addition of a low-grade lymphoma left. So what would be our first diagnosis that we would look for? What do you think?
A neoplasm again.
Postoperative diagnosis, same with the addition of low-grade lymphoma. We're going to end up with 3 codes here.
Eye nasal.
The first one is going to be the lymphoma. Lymphoma of the extranodal orbit.
Extra nodal, what is it? It's like low grade. Doreen, extra nodal, what is that? Is it? It's here. It's mentioned low grade lymphoma left orbit.
I can't hear you.
I mean, like how to figure out extra nodal? Like here they said lymphoma left orbit.
Did you read the whole report?
So the second one you code is going to be the mass.
The second one is actually going to be the syndrome. Look up in the preoperative diagnosis. It says left orbitonasal mass, dry eye syndrome, pseudophakia both eyes, and then computerized tomography confirmed tumor of left orbital, left nasal side. Postoperative diagnosis is the same with the addition of the low-grade lymphoma left orbit. Okay, so extranodal, where's the nodes in the eyes? They're saying tumor left orbital, left nasal side, extranodal. Okay, extranodal. So the lymphoma ends up being the more severe of the diagnoses. So the orbital nasal mass, the lymphoma, that is the first diagnosis. Then we code the syndrome, which is the dry eye syndrome. And then the pseudophakia, which happens to be of both eyes. So those are the three codes that you should come up with. I'll give you ladies a few minutes to try and come up with those three codes. Don't call them out. I'll just call on you. I'll just give you both a few minutes. All right, do you have all three yet?
Almost.
Okay, I'll give you a few more minutes. All right, ladies. Why don't you tell me what you have first, Kelsey?
So for the first one, 202.81. Second, 375.15.
Yeah, I got that one. And this pseudophakia, what is that? V431. I can see it here and then.
What did you have for the last one, Kelsey?
V43.1.
Okay. How did you find it?
Here.
Pseudophakia.
And
Yeah.
here it's saying lens.
What page, Anitha?
It's like 1019 on tablet. It's not saying pseudophakia. Here in index it's saying pseudophakia, but here in tabular it's saying pseudo. It's a different spelling, and said it's lens.
That's okay. That's where you have to be. That's where you have to know what pseudophakia, pseudophacus means. That they're the same.
Mm-hmm.
Okay. Good work, ladies.
So that first one was right? 202.81?
202.81, 375.15, and V43.1. All right. Let's take a quick 5-10 minutes, okay? Then we'll
Yeah.
start chapter 12. I would like to get through 12 tonight.
Too much construction going on. Oh my God, I need to go 40 minutes. It's for me to come from Augusta to here.
Well,
There was construction. Again, here construction. My God, so much time.
oh, I did all but these ones. It's not. Well, these ones I didn't know. This symbol, I didn't know what it meant until now. That it means you could use more than one code. So I didn't have all the codes for that. But then in the workbook, there's just so many, and it took me 3 hours to get through half of these.
Yeah. No, for me, big problem. I have some little bit. If I see so much time, my eyes will get dry and little. That's the problem. I'm not getting it. Did you put your labels?
No, not yet.
I wanted to. I got everything, and then I wanted to. Just at least now I came to know at least little bit. V codes here index and V codes in table. And E codes. I don't know, V codes only here. E codes here and then E codes here. Here in the YouTube video also good. There is some videos that are really good. Are you seeing those?
No. It's just so much.
Yeah, it is so much. I'm not getting time to do.
Oh, I know.
Yeah.
I get 1 day a week in the library,
Hmm?
and it's just not enough.
At least some of them. Oh, see here the sign. Whatever sign is here, this more than one code, right?
No,
That's
it's
the same
different.
sign?
No,
Oh,
different.
that's a bubble like 3. Now I understood what is exclude. Before I was seeing some of the things. And the ones which is like this. You are working harder than me. I'm coming here and she is mad with me.
Yeah, I feel like she gets frustrated with this.
So much to do, but interesting, but so much to do.
Well, thank God we only have to do the even numbers now, because look at chapter 12 in your workbook. I mean, 5 pages, 102 questions. That's just. And I had no idea there was that many in chapter 11.
In exam and test, how do we? Here it's okay. They're saying we in test. Do they allow this too?
Yeah.
They allow
Well,
this.
you get this one. I don't know about that one. Yeah, because then with the test, you'll just have to know how to use the book.
Yeah.
Okay, ladies, what questions do you have?
We're just talking about in test, the real test. Are we allowed this or
About the
how
test?
yeah, no, how we're going to see that code? Are we allowed to take this book or
Yes.
just select from choice?
For the national exam, it will be multiple choice, and you will be able to take your CPT, your ICD-9, and your HCPC book. And that's all you'll be able to take with you. So that's why it's important that you tab it, you highlight it, you underline it. Just like we talked about. So let's go to chapter 12 in our textbook. And with that, turn your ICD-9 book to page 22. Sorry. So with chapter 9, diseases of the digestive system, basically starts at the mouth and ends with the anus and moves on to the accessory organs. You're going to see that there are a lot of extensive subcategories here. You actually have 10 subcategories just with cholelithiasis. And each has a 5th digit subclassification. You will also notice that the presence of hemorrhage is associated with diseases in this chapter. If you are not clear on the documentation, always query the provider. Always. Chapter 10. Chapter 10 is diseases of the genitourinary system. These are where you will find the common codes being used for urinary tract infection, inflammation of the prostate, disorders of menstruation and breast. And when you look at these codes, pay attention because you will probably see use additional code to identify organism or use additional codes to identify lower urinary tract symptom. Chapter 11. Chapter 11 talks about complications of pregnancy and childbirth. You will see that there is extensive multiple coding with a lot of 5th digit assignments and notes. Chapter 11 codes will take precedence over codes from other chapters. So right there in 11A1, second sentence, Chapter 11 codes have sequencing priority over codes from other chapters. You want to highlight that. If the admission for pregnancy is a complication, the obstetric complication would be the first diagnosis. With your Chapter 11 codes, they are only used on the maternal record. Your Chapter 11 codes are to be used only on the maternal record, never on the newborn record. The mother's record, you will see your outcome of delivery code when there's an actual delivery. And it would be V27.0 through V27.9. So when a delivery occurs, the outcome of delivery codes would be V27.0 through V27.9, and they would be on the maternal record. And they're only used on that first delivery, when the delivery has occurred. Not all of your encounters for pregnancy are related. So let's talk about if a pregnant woman comes in with a broken ankle, what would you code first?
Being pregnant?
Right. No,
Actually, she presented with a broken ankle. So you would code the broken ankle first, and then the fact that she's pregnant. Remember, what does the patient present with? The fact that she's pregnant happens to just be additional at this point in time. Okay? Your fifth digits on page 23 in your guidelines, number 4, your fifth digits. These are appropriate for all categories except your 650 code. What requires a fifth digit would be your antepartum, your postpartum, and your deliveries. And you'll notice that they are in brackets underneath the codes. And we've seen some of the fifth digit subclassifications in your book. You have 0, 1, 2, 3, or 4. If you go look in your tabular, 640 through 649, let's take a look. Do you see any subclassifications? Right on page 877. Do you want to read them to me?
So 0, 1, 3.
Yes, tell me what each one means, please.
0, unspecified as to episode of care, not applicable. 1, delivered with or without mention of antepartum condition. 2, delivered with mention of postpartum complication. 3, antepartum condition or complication. So how come only 0, 1, and 3 are in brackets, but you have 4?
1, 2, 3 brackets, yeah.
Oh, okay. 4 is on the next page. 4, postpartum condition or complication.
So what you would do for the code is pay attention if it has brackets, and then make sure you would use only one of the codes that are indicated in the brackets. So the selection of OB principal or first listed diagnosis, if there is no delivery, your principal diagnosis would be the principal complication. If you have greater than one complication, you would sequence any of them first. So when you have an episode where there's no delivery that occurs, the principal diagnosis should actually correspond to the principal complication of the pregnancy that actually necessitated the encounter. So over in the right-hand column on page 23. All right, selection of the primary diagnosis. For routine prenatal visits with no complications, V22.0, so number 1, routine outpatient prenatal visits. V22.0 would be supervision of a normal first pregnancy. V22.1 would be supervision other normal pregnancy. These would always become your primary diagnosis code for your prenatal visits with no complications. If we have a prenatal visit for high-risk pregnancies, this would be your V23 code, and this is where you would see age would be part of this factor. Codes from 655 and 656. Fetal conditions that affect the mother, letter C. Codes from categories 655 and 656. Excuse me. Assign only if known or suspected fetal or placenta problems affects the management of the mother. If they require additional diagnostic studies, observation, special care, or termination of the pregnancy, then you would use these category codes. In utero surgery, number 2 at the bottom of page 23 over to 24. When we have surgery being performed on the fetus, report code 655 or report from category 655. This will identify the fetal condition. Do not use a code from chapter 15, your perinatal codes. Those should be used on the mother's record to identify the fetal conditions. When surgery is performed in utero on the fetus, this is still coded as an obstetric encounter. HIV infection in pregnancy. When the patient is admitted during this period because of an HIV-related illness, you should indicate the principal diagnosis of 647.6, followed by the 042. So letter D on page 24 on the left-hand column. When the patient is admitted with asymptomatic HIV status, we're going to be reporting it with 647.6 and V08. Now, keep in mind that there will be a 5th digit added to the 647.6. We just don't know what it is until we get the documentation. Current conditions that are complicating pregnancies, you would assign a code from category 648 for the patient with the current condition that affects the management of the pregnancy. And you would use additional secondary codes from your other chapters to identify the conditions. Diabetes mellitus in pregnancy is a significant complicating factor in the pregnancy. Your diabetic pregnant patients should be assigned a code with 648 and the secondary code from 250, which will identify that type of diabetes. If they have a long-term use of insulin, that should also be reported, if appropriate, with V58.67. Gestational diabetes can cause complications in the pregnancy similar to those of pre-existing diabetes mellitus. This puts women at a greater risk of developing diabetes after pregnancy. With the gestational diabetes, you would report it with code 648.8. Do not report codes 648.0 and 648.8 together. And again, if there is a long-term current use of insulin, code V58.67 should be reported. Now, if we have a normal delivery, code 650. This is for use in cases when a woman is admitted for a full-term delivery and they deliver a single healthy infant without any complications antepartum. Code 650 will always be your principal diagnosis. So without complications, 650. If they have complications, you would not use 650. You would rather use the outcome of delivery code, V27.0 for single live born. Your postpartum and peripartum periods, letter I on the right-hand column on page 24. The postpartum and peripartum periods, this is the time after delivery and it continues for 6 weeks. Your peripartum period is the last month of pregnancy to 5 months postpartum. If there's any postpartum complications, any complication that occurs within that 6-week period, that would be a postpartum complication. Complications that occur after the 6-week period, you can report Chapter 11 codes and make sure that the provider documents that this is pregnancy related. Any complications that occur during the same admission as delivery will be reported with the 5th digit 2. And any subsequent encounters or admissions for these postpartum complications will be identified with a 5th digit 4. Number 5, admission for routine postpartum care following delivery outside the hospital. This is if the baby is delivered prior to admission, such as at home, in an ambulance, in the car, in the emergency department. Do not code the delivery. Again, do not code the delivery. You would code only the postpartum care.
Should I write that?
Yes.
No, it's pretty self-explanatory on number 5. You might just want to put a note beside it, in the car or ambulance or at home. Over on page 25, late effect of complication of pregnancy, we would use codes from 677, which would be late effect of complication of pregnancy and childbirth. This would be reported when an initial complication of pregnancy requires care or treatment at a future date. Like all of your late effects, code is sequenced following the complicating condition code. For your abortions, the codes 634 through 637 will require a 5th digit. And you want to put a note next to number 1 here, K number 1, that this has to do with miscarriages. So next to K number 1, this has to do with miscarriages.
Oh, it's not hearing. I can't hear, right?
For your 5th digits that are listed under each code, 0 would be an unspecified episode. 1 would be delivered with or without complication. And these will be in your tabular, so you don't have to worry about writing them down. And then 3 would be antepartum condition or complication. Not all of your 5th digits may be assigned a 2 or a 4. You just want to read your notes very carefully. Abortion with live-born fetus. Attempted abortion, if it results in a live-born fetus, you would appropriately code 644.21, which is early onset of delivery. So I'm over on number 4 on the right-hand column of page 25 in your guidelines. Then you would use code from category V27 for outcome of delivery. And also the attempted abortion procedure code would also be assigned. Retained products of conception. Their subsequent admissions for retained products of conception that follows a spontaneous or legally induced abortion would be reported with a code from 634, spontaneous abortion, or 635, legally induced abortion. There would be a 5th digit, number 1, to show incomplete. And then if appropriate, the patient previously, even if it's appropriate, even if the patient is previously discharged with a diagnosis of complete. So if the patient's diagnosis is they're discharged and the doctor writes complete, you would want to just double check your diagnosis codes. All right, any questions on that chapter?
No.
All right, let's move on to diseases of skin and subcutaneous tissue. So again, as you have guidelines in your textbook, follow along in your ICD-9 book. So for the skin, we have epidermis, dermis, subcutaneous tissue, infectious skin and subcutaneous tissue, and scar tissue. Our accessory glands are the sweat glands, the sebaceous glands, nails, hair and hair follicles, and other. So chapter 12, this has to do with the integumentary system. So skin and subcutaneous tissue is integumentary system. Okay, integumentary. So does integumentary system only include the skin?
No.
What do you think? No, it does not.
Yeah.
What else is included in the integumentary system? What do you think, Anitha?
Like subcutaneous.
Hair, skin, nails.
Yeah, hair, skin, nails.
Right, hair follicles, nails, glands. And what
Sweat.
two glands are covered in the integumentary system?
Your sweat glands.
Right, sweat and sebaceous.
Sweat glands, yeah.
So you will have multiple codes that will often be necessary. If there isn't a combination code to describe the diagnosis and the cause, then both of these diagnoses would be coded fully to describe a condition. So if I tell you cellulitis due to staph, how would you code that, Kelsey?
You would code staph first, right?
Nope, tell me what happened. Why are they coming in?
The cellulitis, is that what you said?
Right, the cellulitis.
Mm-hmm.
And then what was the cellulitis?
The staph.
Okay, so look it up. Tell me what you would get. Both of you.
It's
step 682.9. Hold on.
For the cellulitis, yes. And what do you have for the staph?
Staph just says C condition.
staph. What is that?
So underneath cellulitis, what is it?
Like staph means staphylisis. Staphylisis or what? Yeah, I don't see here. I saw that. Staph. I don't see the staph. Under cellulitis. Septic. No.
One moment.
Where is staph? No.
Okay, because if you go over to page 890 to the category code 682, so page 890 in your tabular, what does it say?
Unspecified site.
Nope, hold on. On page 890, look at category code 682, other cellulitis and abscess. It says includes, and then it says use additional code to identify organisms such as staphylococcus, and then excludes. This includes, use additional, and excludes applies to all of the 682 codes. So this is when I mentioned early on in the class, you have to read the before, the middle, and the end. So when you get a code, always go to the first category to see if there's any of this information. It's not always going to be under just the one code. So for 682.9, it would include this information under 682, and then you will also want to use the additional code to identify the organism, and it's telling you to go to 041.1. So you would do that and confirm, is it 041.1, and then do I have a subclassification? So for this example, it would be 682.9 for the cellulitis, and the staph would be just 041.1, and whatever we chose for the fifth category, for the fifth digit. Okay? Does that make sense?
Yes.
All right, let's move on to chapter 13, diseases of the musculoskeletal and connective tissue. All right, chapter 13 will describe the diseases or the conditions of the bones, the joints, and the muscles. The note at the beginning of the chapter presents important information on fifth digit subclassifications. So I would like you to turn to your tabular to 710, code 710. It should be on page 899. What does it say underneath the heading, Anita?
Includes.
At the very top.
Oh, it's here. Okay, 0 site unspecified.
Nope. Up above the box.
Oh,
Keep going.
okay.
Use
Oh,
additional.
yeah. Yeah, use additional. These are musculoskeletal system correct. Use additional, yeah.
Yes, use additional external cause code, if applicable, to identify the cause of the musculoskeletal condition. So you want to keep in mind that you might have some fifth digit subclassifications going on in this chapter. You will also find that in this chapter, your arthropathies, that's your joint disease, and your related disorders. You also want to code to the highest level of specificity. Your dorsopathies, those are the curvatures of your spine. The rheumatism would exclude the back. Osteopathies, chondropathies, and acquired musculoskeletal deformities. You have newly diagnosed pathological fractures. And again, throughout this section, you will have extensive notes and fifth digits. So this is where you can make terminology notes to yourself if you need to. So again, just refer to the note at the beginning of the chapter with the fifth digit subclassifications. Pay attention to the details that are located throughout those categories, okay? Chapter 14 and 15, or chapter 14, are your congenital anomalies, page 26 in your ICD-9 book. Abnormalities at birth would be the codes from 740 to 759. The conditions that are originating in the perinatal period. What is your perinatal period, Anitha?
Perinatal?
Perinatal, yes, perinatal.
When during pregnancy, like, right? No.
Yes, perinatal is the period through the 28th day following the birth. Peri, not pre.
Okay.
There are codes that can be used after the 28th day if it is documented that the condition originated during the perinatal period. Keep in mind that the perinatal applies only to the baby and postpartum applies only to the mother. Using the V codes, using V code 30 through 39, your V30, I'm on page 27, letter B, use of codes V30 through V39. Your V30 code is the single live-born. Your V31 is live-born twins. If they are an inpatient, this would be the principal diagnosis. Keep in mind that the V30 code is only used once, and it is used for where the baby is delivered. So using category V29, you want to assign the V29 when a healthy newborn or infant is evaluated for a suspected condition that is not found. Do not use a code from V29 when the patient has identified signs or symptoms of a suspected problem. You would use a code from V29 as a principal code when you have readmissions or encounters when the V30 is no longer applicable. And keep in mind that your V29 code is used as secondary code after the V30 code, which is the outcome of delivery. Turn the page to 28. Maternal causes of perinatal morbidity. These are codes from categories 760 through 763. These will be assigned only when the maternal condition has actually affected the fetus or the newborn. The fact that the mother has an associated medical condition or experiences a complication does not justify routine reporting of these categories.
What happened? I think we can't hear.
All right, so where did I lose you guys?
Oh,
What section?
It was right after the maternal causes of perinatal morbidity.
Okay. So for additional perinatal diagnoses, letter H, on page 28, left-hand column, code your newborn conditions that require treatment, further investigation, additional resource, prolonged length of stay, and any implications for future care. If this newborn condition's signs and symptoms are insignificant and they resolve with no treatment, you would not use a code, even if it was documented, because it has resolved on its own. Prematurity and fetal growth retardation. Codes for newborns from categories 764 and 765 would be used. Category 764 is for slow fetal growth and fetal malnutrition, and 765 disorders relating to short gestation and low birth weight. These are not assigned solely on the birth weight or the gestational age of the newborn. These are going to be used as clinical assessments. Use the physician's assessment of maturity and use any additional codes for the number of weeks of gestation, such as 765.0 and 765.1. Your newborn sepsis. Letter J. code 771.81. This should be assigned with a secondary code from category 041 to identify the organism. You would not report a code from 038. Do not assign 995.92 or 91 for sepsis. You would assign 771.81 because this code best describes the sepsis. All right, chapter 16. Signs, symptoms, and ill-defined conditions. These are codes 780 through 799. If there is not a definitive diagnosis, do not code a sign or symptom. Signs and symptoms are used for encounters only until a definitive diagnosis can be made. No specific diagnosis can be made after an investigation, then you can use signs and symptoms. If a patient fails to return or is referred elsewhere, you may be able to use a provisional diagnosis. Chapter 17, Injury and Poisoning. Some of the examples of what you will be coding for here would be fractures, dislocations, sprained strains, intracranial injury, internal injury, crushing injury, foreign body, burns, late effects, poisoning. Your external cause codes are your E codes. And again, at the beginning of this chapter, there are specific instructions for the entire chapter. So take a moment and turn to the tabular to the 800s. Kelsey, can you read me what the notes start underneath injury and poisoning?
Hold on. To use additional code for retained foreign body if applicable. And use E-codes to identify the cause and intent of the injury or poisoning.
Okay, Anita, will you read number 1?
I'm not there.
Which page? 953.
So, okay. The principle of multiple coding of injury should be followed wherever possible. Combination categories for multiple injuries are provided for use when there is insufficient detail as to the nature of the individual conditions, or for primary tabulation purposes when it is more convenient to record a single code. Otherwise, the component injury should be coded separately. When multiple sites of injury are specified in the titles, the word with indicates involvement of both sides and the word "and" indicates involvement of either or both the sides. The word "finger" includes thumb.
Kelsey, number 2.
Categories for late effect of injuries are to be found at 905 to 909.
So you want to keep in mind that this starts your your injury and poisoning section, and then over to the right-hand column on 953 in your tabular, it tells you everything it excludes, gives you some terms and descriptions, and then moves on to your 5th digit subclassifications. So again, paying attention to your category beginning. Where do all the codes start? Okay? All right, let's go back to our guidelines. Burns. When we're coding burns, over on the right-hand page of 29, right-hand column, burns. Coding of burns. Sequence the highest degree of the burn first. Your current burns are in category 940 through 948. And your codes are classified by the depth, the extent, the site, and if necessary, the agent. So the depth is the severity. The extent would be the percentage of the body surface. The site obviously is the anatomical site of the body, and then what agent was used. The depth of the burn is classified as 1st, 2nd, and 3rd degree. Your 2nd degree burns may also be referred to as partial thickness burns. The classification of the burns, according to the extent of the body surface area involved, code from 948. When the burn site is not specified, there may be additional data that is required. Burns of different degrees but of the same local site, you would report the highest degree only. Your non-healing burns are coded as acute burns. And you would report 958.3 as an additional code for any infected burn site. For your codes, to assign codes from category 948, turn to page 30, left-hand column. Your 4th digits will be the percentage of the total body surface involved. Your 5th digits will be the percentage of body surface involved in 3rd degree burns. And the rule of 9s apply here. And you'll see in the tabular, you'll have a diagram for the rule of 9s as well as in your textbook. If you turn to page 985 in your tabular, 985, take a moment and just look at the rule of 9s for an adult and for a baby. And again, pay attention to the note right by the category 948, what it excludes, your subclassifications. Okay, let's go back to our guidelines, page 30. Debridement of wounds, infection, or burn, letter D. For excisional debridement and non-excisional procedures, you want to make a note for yourself near letter D that these are not in the alphabetic index. These are going to be found in the outpatient procedure codes. So in the way back of the book, you have procedures, outpatient procedures. Your excisional debridement actually involves cutting away, as opposed to mechanical debridement, which would involve brushing, scrubbing, or washing. So excisional is cutting away. It's performed by a physician. Your non-excisional is shaved or scraped, performed by a physician or non-physician. With your injury and poisoning codes, you would use a separate code for each injury. The most serious injury is the first code. Your superficial injuries would not be reported if they're in the same location as the more serious one. All right, let's go back to page 29 for a minute, acute fractures versus aftercare. If we have active treatment of a fracture, the codes would be 800 through 829. This is where the physician evaluates. It may be an ER encounter, surgical treatment, or closed treatment. After active treatment is completed, use aftercare codes. For your aftercare codes, what kind of codes would these be, Kelsey?
Secondary.
Yes, and they would be your V codes because they've come under the heading aftercare. Multiple fractures. These are the same coding principles as multiple injuries. Code your multiple fractures by site and then sequence them by severity. Your code will describe the accidents, the injury, or the open wounds. Your combination codes also should have sufficient detail in the medical records. Again, always code to the highest level of specificity. If your fractures are not indicated as opened, as closed or open, you are to assume that it is closed. Again, if the fracture is not indicated as closed or open, assume that it is closed. If you have a bone that is fractured and dislocated, you would code the fracture only because this is the highest level of injury. If you fix the dislocation, it would be included with the fracture repair. Do you understand that?
Yeah.
All right. Let's turn back to page 30 and talk about adverse effects, poisoning, and toxic effects. This has to do with the properties of certain drugs, medicinal and biological substances, or combinations that may cause toxic reactions. You want to classify as an adverse effect when the drug was correctly prescribed and administered. Remember in your ICD-9 book, we found the table for poisoning, injury and poisoning. And across the top, we wrote what was an adverse effect. Well, what you want to keep in mind here is that you want to code the effect first and then use the E code from the therapeutic column of the drug. Poisoning occurs when what? Kelsey, do you remember when poisoning occurs? Tell me, give me a few examples.
Too many drugs.
You gave us an example that the elderly person, she thinks she like a dementia, then she takes 1,000, then again something like that.
Right, wrong
Again,
dosage might have been given
wrong.
in error. Medication might have been given to the wrong person. Medication might have been taken by the wrong person. Medication overdose might have occurred. Medications taken in combination with alcohol and or recreational drugs. Over-the-counter taken in combination with prescription drugs without provider approval. So when we are sequencing our poisoning from the table of drugs and chemicals, we would code the poison first, then the manifestation of the poisoning, and then the corresponding E code to report the intent, or if it's unknown or questionable, report the intent as undetermined. What do our E codes do, Anitha?
Those are external cause. Those are secondary cause for the primary effect.
They are external cause codes. They provide supplemental information.
Yeah.
And they are never, 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 never first listed diagnosis. They always will identify the cause of an injury or poisoning, the intent, whether it was unintentional or intentional, and the place of occurrence. Some of the general guidelines will be found in Volume 1. If you have an initial encounter, use an E code. If you have a subsequent encounter, you would use your late effect E codes. So what do we know by using the word intent? Kelsey?
That poisoning was intentional? Did it on purpose?
Possibly. It could also be that the intent is unknown, unspecified, or questionable. If it is any of these three, we would code it as an undetermined. There has to be a definitive diagnosis of intent from the physician in order to use a specific code. So you were correct. Intent means that it was done on purpose, but if it's written unknown, unspecified, or questionable, we will code it as an undetermined. All right, let's talk about if we look at the table of drugs and chemicals, which you have already before, it is an alphabetic listing of codes. Do not code directly from the table. You want to reference your tabular too, okay? Just like with the other tables. If we have 2 or more substances involved, turn to page 42, right-hand column, number 4. If 2 or more drugs are involved, page 42, right-hand column, number 4. If 2 or more substances are involved, code each one unless there is a combination code that exists. You want to code the substance that is more closely related to the principal diagnosis. You want to include one code from each category, such as cause, intent, or place. In the interaction of a drug and alcohol, you want to use poisoning and E code for both. So let me just repeat that. If 2 or more drugs or medicinal or biological substances are reported, each one should be coded individually unless there is a combination code that is listed in the table of drugs and chemicals. Your first listed E code should correspond to the cause of the most serious diagnosis. Again, if we have unknown, unspecified, or questionable, we will code it as what, Anita?
I didn't.
Undetermined. Undetermined.
Oh.
Undetermined. Letter E. Unknown or suspected intent guideline. Letter E. Bottom of page 42, right-hand column. Over to page 43, left-hand column. If the intent is unknown, unspecified, or questionable, code as undetermined. If we have an undetermined cause, where the intent is known but the cause is unknown, use unspecified accident. E928.9 or E958.9, suicide and self-inflicted injury by unspecified means, or E968.9, assault by unspecified means. Your E-codes should rarely be used because your documentation should normally provide sufficient detail to determine the cause of injury. So these 0.9 codes, these undetermined cause codes, should be very rare. Letter G, the late effects of your external cause codes should be used with late effects of a previous injury and poisoning. They should not be used with related current injury codes. And we talked about a late effect being a burn or a scar. Can you think of any other late effect? Okay. Again, you have some good examples in your textbook as far as this goes, for examples. The rule of nines, you have figure 12-6 in your textbook for adults and children, but you also have a figure in your ICD-9 book, which will be good when you're coding. Any questions on chapter 12, ladies?
Not yet.
Okay. So, let's talk about homework. You will do chapter 12, theory and practical, in the textbook. Theory and practical in the textbook. And in the workbook, all the even numbers. And then exams on Evolve. So we just got through the foundational parts to get us started with next week.
You said from next week we had to use the tablet, right?
No, you'll be here next week.
Oh, okay.
So next week, read chapters 13 and 14. Do the in-chapter exercises. 13 and 14 will be your CPT book and your HCPC book.
Not in this.
You want to bring your CPT and your HCPC book next week.
Oh, okay.
So again, chapter 12, theory and practical. Read 13 and 14 and do the in-chapter exercises. In the workbook, chapter 12, even numbers. What is your takeaway from tonight, Kelsey?
Just remembering to refer back to the guidelines.
Again, you're not gonna remember them, but
No,
knowing
refer
where
to
to
them.
find them.
Yeah.
That's the key, knowing where to find them. And Anissa, what is your takeaway?
Yeah, guidelines is more important. I mean, like whenever you have question, just refer and then. And if you, especially if you have like multiple coding for injuries, burn.
Yes. All right.
Oh, okay. As a chiropractor, do you use all this stuff? I mean, it's like fracture.
Not really.
Yeah.
We don't, some offices, I don't see a lot of that. It's more musculoskeletal conditions, misalignment, subluxations, not really a lot of fracture type stuff. That would be more your orthopedist.
Okay.
All right. So if there is not anything further, ladies, I wish you a good evening. Have a great week.
Thank you.
And I will see you back here next week. When you set up your jabber, let me know. And if you need to test it during the day, Amy or Jamie will be happy to do that with you.
Yeah.
Okay, so just to make sure your jabber works.
Okay.
All right?
Thank you.
Thank you.
You're welcome. Have a great week.
You too.